Okay, in this video I'm going to walk you through the various muscles that can be seen on the little muscle man here. So what I'm going to do is essentially start kind of at the top and I'll work my way down. So I'll kind of pull my camera up here close to the face so we can see some of these facial muscles. First thing we can see at the top, sitting on top of our skull, you can see if I kind of tilt him this way, is a nice kind of flat tendon-like structure. It's called the epicranial aponeurosis. It is what connects the frontalis muscle, the frontalis muscles on our forehead, to the occipitalis that's on the backside of our head. Together, that structure, those muscles, make up what we call the occipitofrontalis muscle. So once again, frontalis, epicranial aponeurosis, and then on the back side is the occipitalis. Moving down from the frontalis, you can see these circular muscles that surround our eyes. Those are our orbicularis oculi muscles. Once again, orbicularis oculi, which you do not want to confuse with the circular muscle that surrounds our lips, which is the orbicularis oris muscle. If I kind of tilt our muscle man here, or angle him to the side here, you can see a couple important muscles for mastication. Once again, mastication is the act of chewing. First muscle of mastication is what number 9 here is pointing to, which is the masseter muscle. It's a very important muscle. You can actually feel that in your cheeks if you hold your jaws kind of like this and then you bite down. And then just above our zygomatic process is our temporalis muscle, which is in the temporal region of our skull. Temporalis muscle runs actually underneath of our zygomatic process, or deep to our zygomatic process, and is going to attach to our mandible to help us chew. Now, while I'm right here on the side of the head and neck, you can see this good sized muscle running kind of right behind our ear down to our sternum and clavicle. That's called the sternocleidomastoid muscle, and it gets its name because of its major attachment points. And if I kind of flip back here to the anterior view, moving down into the chest, very visible on the outside here is the pectoralis major muscle. You can see at the top here of our shoulders, just above it on both sides, would be our deltoid muscle, and we'll talk a little bit more about that when we get to the arm. Now if I move down into the abdomen, what we have on the right side of this fella is another one of those kind of flat-like tendons. We call this the rectus sheath, and it encloses or covers up the rectus abdominis muscle, which is a muscle that the fibers run in this general direction. And if you look here, you can see that there are these structures called tendinous intersections that give us that kind of six-pack appearance when you have somebody that is well built or well defined, very little muscle or very little fat mass covering those. Running right down the middle from our xiphoid process down to our pubic symphysis, and it's not the most visible on this model, but it kind of intersects our umbilicus, is our linea alba muscle, or our linea alba is kind of just a line that separates our two parts of our rectus abdominis muscle. On the lateral sides of our abdominal region, you'll find the external abdominal obliques, and they get their names because the fibers run kind of at an oblique angle. Now, since I'm right here, I'm going to pop off the chest, so I'm going to talk about a couple muscles on the inside of the chest. So what we can see in this view is the transverse abdominis, which is what number 25 is pointing to. Now if I kind of look back here, remember our rectus abdominis, the fibers run vertically, and the transverse abdominis muscles run horizontally, and the transverse abdominis is deep to the rectus abdominis. We can also kind of pop back over here, and you can see what number 26 is pointing to, or what it's labeling. This isn't something I'm going to ask you on the test because there's really no way to label that, but that would be the internal oblique muscle, which is a lot like the transverse abdominis in the fact that it's deep to some outer muscles, in this case the external oblique. Kind of look here, you can see the lungs and the heart really nicely. Here's the liver. You should be able to identify this kind of muscle right there. That's our major muscle of inspiration, the diaphragm. Okay. Along with the diaphragm, our intercostal muscles aid in breathing. Over here on the inside of our rib cage, between each one of our ribs, you should be able to identify the internal intercostals. Those actually help with exhalation. Okay, so if I put my chest plate back on here, hopefully I don't drop it. Okay. I can kind of move to the back side of our fellow. Okay. Right away you can kind of see this diamond-shaped muscle on both sides of his shoulders. That is the trapezius muscle. A lot of times we just kind of call those the traps. Once again, you can still see the deltoid muscles from the posterior view because they kind of wrap around the shoulders kind of all the way around. Over here on his left kind of shoulder on his back, we'll be able to see two major muscles, the teres major and then the teres minor muscles. Teres minor and the teres major get their names because of their size, major being bigger than the minor. But the minor is actually the only one of the two muscles that is considered a rotator cuff model. If I move down to the lower part of our back, or on his back I should say, what is not labeled for whatever reason are the two big latissimus dorsi muscles, or just the lats. If you continue down, you can see that they kind of form a kind of flat tendon-like structure. We call that the thoracolumbar fascia, and that's what number 38 is pointing to. What I can do now, or what I'm going to do now, is kind of move into the arm. And since I'm in the posterior view, I'm just going to kind of stick with the posterior view. Number 48 and 49 are both actually pointing to the same muscle. The triceps brachii muscle. As far as I'm concerned, you just need to know both of them as triceps. One of them is the long head, one is the short head, and I'm not super concerned with you knowing that. Now, in the forearm, what we're looking at here is the back side of the forearm, the posterior side of the forearm. You can see this kind of band covering what would be like what my watch is doing. And that is the posterior retinaculum. On the front side, we'll find the anterior retinaculum. Those are fibrous bands that basically hold all those tendons kind of in place. Right there, number 53 is visible to show actually the flexor carpi ulnaris muscle, which would, if you compare it to my forearm, be the one that runs down my pinky side, and it actually is almost a little bit better shown kind of from that posterior view. So I kind of move back around to the front side, looking just before I get to the front side and the lateral side. Once again, here's our deltoid. Between our triceps and our biceps brachii is the brachialis muscle, which is what number 41 is pointing to. So we have biceps brachii, brachialis, triceps brachii. Okay, and if I kind of twist it around here to the anterior side, we can pull it up closer here. Number 42 is the brachioradialis. So you have the brachialis up in the upper arm, the brachioradialis, which gets its name because it runs from the upper arm down the radial side of the forearm. Number 50, right here, kind of crossing from the medial side of our elbow to to the lateral side of our forearm is the pronator teres, which is going to help pull the thumb side down and pronate our forearm. Okay. If I kind of continue to twist it like this, so you can see 51 and 52. 51 is the flexor carpi radialis. You can see it's going to be a flexor, and it runs down towards the radialis side. The radius side is our thumb side. And then 52 is the palmaris longus. Along with the flexor carpi ulnaris, those are going to perform the act of wrist flexion. And on the anterior side, you can see another band. Like I said just a little bit ago, is the flexor retinaculum. If I kind of twist around here to look at kind of more of the posterior side of the forearm, we'll see some of the extensors. For example, number 42 here is the extensor carpi radialis longus, a long muscle that extends the carpals and it runs along the radius side of the forearm. 43 next to it is, sorry, excuse me, I said 42. 42, sorry, is the brachioradialis. 43 was the extensor carpi radialis longus. 44 is the extensor carpi radialis brevis. Sorry, my camera was off with it. So you have the longus, the brevis, and longus means long, brevis means short. And so those are some of the major muscles that perform carpal extension, pulling our wrist back. Now, right here is a pretty good way to see the serratus anterior muscle. It's kind of a muscle underneath of our armpit that kind of has that serrated knife jagged look to it. And, that pretty much concludes the upper body. So as I move down to the lower body, I'll start at the hip, and basically just inferior to our iliac crest, you'll find the tensor fascia lata muscle, which is what number 56 is pointing to. Sorry, that's 55. Yeah, sorry, 55. So 55 is, you know what, I told you wrong. This is specifically just the iliotibial tract. 54 is the tensor fascia lata muscle. They are actually kind of one and the same. The iliotibial tract, which is sometimes called the IT band, is actually formed both from the glute muscle tendon and the tensor fascia lata muscle. Our quad muscles include 4 major muscles. The one that runs right down the middle of our femur is our rectus femoris, which is what 57 is. And then you've got 3 vastus muscles: vastus medialis, vastus lateralis, and then it's not visible in this image is the vastus intermedius, which would be deep to that rectus femoris. Running kind of like a seatbelt from the lateral side of the hip to the medial side of the knee is the sartorius muscle. And then just on the inside of that is where we can see the adductor longus muscle. I continue to kind of turn it like this. There's a long kind of strap-like muscle again. This one just runs medial to medial, and that one is the gracilis. Okay. If I completely wrap around here to the posterior side, zoomed in right away here at the big butt muscles, the gluteus maximus on both sides, and then the gluteus medius and minimus are going to be deep to it. And unfortunately, we can't see that since this model doesn't come apart. Zooming in kind of here at the hamstring region, we have the biceps femoris muscle. Specifically, that's the long head of the biceps femoris, but I'm not particular on you knowing long head versus short head for it. Then you've got the other 2 muscles, which includes the semitendinosus and then deep to it is the semi-membrane osseous. And then if you kind of look right in here at number 60, 60 is the adductor magnus, so another one of those adductors of the thigh that kind of brings our legs together. Moving down into the calf region, we can see the two big heads of the gastrocnemius, or sometimes we just call the gastroc muscle, which continues down into our ankle as the calcaneal tendon. Okay, calcaneal tendon can be seen there. Kind of twisted a little bit like this. We can kind of pick up the fact that the gastroc is a very big muscle, and then what we cannot pick up on is the fact that there's a muscle just deep to the gastroc that is also part of our calf muscle, and we call that the soleus. If we continue on around, we can see the tibialis anterior muscle, okay, which runs alongside the front side of our tibia, which you can see tibia there a little bit. If we kind of move back up here, so I kind of forgot, but I don't want to forget before I completely shut the video down, is the patellar tendon, which is below the kneecap, and then above the kneecap is the quadriceps tendon. And then the very final structures are these two bands at our ankle, the superior extensor retinaculum and then the inferior extensor retinaculum. Okay, that wraps up this fellow here. Thank you.